happy to work without any salary? I would love to hear your thoughts about this.
Yeah,
I
even I thought the same, like, oh, sorry.
Okay, so I completely agree with Dr. Malik. I'm assuming. I think your answer was not really up to the mark. You are essentially supposed to start with the clinical skills that you bring to the program because that's what they're looking forward to. So you talk about your strengths and in any other way that you are willing to contribute to the program, if it's research or anything like that. And then in the end, you add that you are from that area as well. Because if you're from an area, there are going to be multiple programs and all of them are not going to be your number one. So your ties come in the end, and visa requiring and financial compensation, I don't think you should mention these at all.
Yeah, that's good information. So I would like to tell something about this question. Like, can I answer it?
Sure, go ahead. Like Ria, have you completed talking, completing your point? So, like, can doctor speak? Like, just go ahead. Just go ahead. Yeah.
Yeah. So I can start this question as, yeah, I'm sure every applicant is well deserving, not only me. So yeah, every applicant is well deserving, not only me, but I think I'm deserving to this seat because of I'm willing to adapt to new environment very faster. I'm compassionate to work for a longer hours. I have been an experienced person. Like I have got USC in these many, like in Chicago or in this place, or I have done very longer hours in various settings like outpatient and inpatient. And I am more open to work anywhere, and I want to work as a voluntary person. I think these are some of the ideas I have got.
Yeah, that's a good point. Like, I know where you're getting this answer from.
Yeah, I have seen your Insta and some of the things I have seen.
Even I liked that answer very well. So yeah,
Mm.
even I was going to answer the same. Yeah, that's a good point. Like adaptability, and we make the work environment very good. We are adaptive, we are efficient, and that's what your program needs. So yeah, we can just go on with those points as
You
well.
want to add anything else, Ayushman, to this answer after seeing that answer?
I
Like,
just have something to say.
yeah, go ahead.
I'm just about your last point. I didn't really understand. You said that you would voluntarily work.
Like hospitals do work voluntary experiences, right? Outside the
Oh, okay.
hospital, putting up voluntary camps.
Okay, so I think you're confusing two words, voluntarily and
Yeah,
volunteering, right?
it's
Like,
just a draft. I haven't made a entire note of it.
okay,
You
yeah.
can
So
also
that
do
just that
community
point,
work.
you should explain your what you mean exactly, because voluntarily would just be that you're willing to work there, compared to you want to contribute to volunteering
Yeah,
opportunities.
yeah,
So maybe that's a better way of saying it.
yeah,
Yeah. All right.
Can you say your answer once more?
yeah. I can. Like every person deserves. I mean, every applicant is well deserving. Not only me, but I think I am deserving to this seat because of I am open to work. I am willing to adapt to the new situations very faster. And I have done my clinical experiences in so and so colleges, like I have done in Chicago or anywhere else. And I am experienced in these various settings like outpatient, inpatient, and I am also willing to work as a voluntary participant from your hospital for underdeserved.
Hi, am I audible?
Yes. Thank you.
Yeah.
Hello?
Yeah, yeah. Go
Yeah,
ahead.
you can say volunteer, except the volunteer you can say community work. That's more of a good word.
Yeah, that's a good answer. That's like, yeah, that's a good answer. But since everybody will take that idea, so yeah, we have to add certain things to that as well. So we can work on drafting our answer well. Otherwise, it's a good answer, right? You don't have to put stories and everything. So that's a, I feel the very direct answer to give, and that's a good answer. So Harshita, you're just raising your hand. Do you have anything to add, or do you want to answer this question?
Dr. Marwa's response. I agree with the visa part. Like you can tweak that about like that into a better this one. And when she said she's compassionate, hardworking, I would like her to, I think, bring in her experiences which show that she's a hard worker, or let's say a team player. Like, if she's done some voluntary work, she can say that, like I worked with a team of volunteers, and like, that kind of shows that, she has experience with that quality, specific quality. And yeah, I just wanted to add that.
Okay, anybody else wants to
Can I
answer
say
this
something?
question? Yeah.
I really love the answer, but what I was wondering is, should we add our unique qualities? Everyone has something unique in their CV or in their personality. So while we are saying that, like, what makes us different from others is something unique which we have even in our CV. So should we talk about that? Because I think everyone has observership in their CV. No one will apply in this cycle without observership, like very less chances. So we are just repeating whatever in our CV, that is okay.
Yeah, at the end of
I
the
would
just have the limited qualities. Everybody has that in common. So yeah, everybody will be talking about the same. So yeah, just go ahead. Sorry, somebody was saying.
Plus, sorry.
Yeah, go ahead, please. I'll mute my mic.
Oh, I was saying, plus another perspective I heard today was that every interviewer gets like 20 candidates to interview, and it's not necessary that when they're coming and sitting for the interview, they'll remember all of your CV. So yes, like don't say out everything line by line in your CV, but if you point out some important parts that you want them to know, which they might not remember because they just saw like 10 candidates before you for 20 minutes each, and they didn't really get time to look at your CV again. So that could be a nice thing to do.
Oh, thank you. I didn't know about that.
I would also like to
Pleasure.
add that for the response that was just given, I would like to add on that it's always better to provide examples to the quality that you are mentioning. For example, when you say that you are adaptable, you could perhaps mention at the same time that your clinical experience started off from India, for example, or Pakistan, and then when you moved to the US to gain clinical experience, you could say how well you adapted. You could give an example like how quickly you understood the system or started typing notes in the EMR. I think that would be a good example to give alongside that in order to put more weight to your answer. Other than that, the answer on to for me, I think it's quite generic. I agree with the other respondents and participants who said that we should add something from our CV that really sets us apart. And it could be individual to all the respondents. We could add something other than our clinical experience as well, just in order to make it more personalized and less, less practiced. Just my 2 cents on the whole thing. I would love to listen to the others about this.
Yeah,
So,
thank
regarding, whatever the previous doctor had mentioned, I think you can mention the qualities and tie it up with the experiences which you have not mentioned in the CV, because we had a limit of 10, right? So, in case you didn't get a chance to mention other experiences, you could probably, incorporate those into this answer. But I'm not sure if it's correct or not. But yeah, if anyone wants to say anything, please go ahead.
So basically, that what I feel is that we have to, in this question, we need to mention the strengths that we have, like whatever strengths we are going to mention for our strength question. Basically, we need to mention, emphasize on that thing only in this question, because it's very unlikely that they'll be asking us about the strengths and everything in the same interview. Like, so yeah, that's what, like, we have to mention our strengths only with examples over here.
Yeah, I think so. But if at all, if a person asks both the questions in a single interview, what do we do then?
That's my strength. That's what I'm going to bring to your program, right?
Do you want to repeat your strengths once again then?
I will have to repeat it. Doesn't matter. See, at the end of the day, I don't want to be quiet in that question. I have to speak something out, even if that's wrong. Doesn't matter.
Then I think we can do one thing. We'll go with 6 strengths. We'll mention first 3 strengths in a question for strengths and weaknesses, and we'll mention some other strengths in this question.
Yeah, that is what we are going to do.
Yeah.
Yeah. So anything, anybody else wants to answer this question? Like, you can just go ahead, switch on your mics and answer the question.
Yeah, I want to add something to what the previous applicants have, I mean, the previous participants have already, discussed that, of course, you need to mention your strengths to the program. But what I think is that the answer to that question should actually start from what the program is looking for in their applicants. Like every program has a website, and when you go to their website, they have a certain mission or the goal, and they're actually looking for the right fit. So you already, what I think is that you need to tailor your answer to that. Like if a program is looking for applicants with a certain attributes, you just want to incorporate that certain attribute that you carry, which basically aligns with the program's missions into your answer. So the answer should start from that point on, and then you can discuss your strengths, and then even you can incorporate that visa thing into that. But I think the start should be from what makes you the right fit for the program.
I got your point, Dr. Ritesh, but can you give me a slight example for that thing, what you have told? Like I need
Yeah, so like if you go to a certain program's website and they say like we are looking for a person who is team player, who is a learner, who is, a person that has great regard for a lot of patients and who is experienced, or maybe, maybe after a certain amount of training can get experience with treating patients from diverse populations. So if you have any experience with treating diverse population, like if you have worked in India and then you came to US, you treated diverse patient population. So that is something that you can incorporate and say, yeah. So if your program, treats a lot of patients from different backgrounds, I have this quality. I have been in India, I have been in US. So I know how to, treat patients who come from different cultural backgrounds, and I can easily connect with them. So that is just one example of how you can go about this answer.
Yeah, thank you. But, can you start that question with you are telling something about the starting line? Can you start how do you want to start that question answer?
Okay, just 1 minute. Sorry to interrupt you guys.
Yeah.
No program mentions what type of candidates they are looking for. They just tell this is our mission, this is our program. They never mention what type of candidates you are looking for.
Yeah. So what happens is that when they mention that we have certain mission or a goal, so you can actually find out what kind of applicants they are looking for, right? If you are writing an LOI, you certainly must be writing why you are a good fit for the program. So why that good fit comes from the knowledge of that program, which is on their website. Like if they are in a certain small community and they are mostly catering to patients that come from underdeserving population or something like that. So that is the information that you can take from program's website and then incorporate into your, answer.
That would be great if you can give an example how to incorporate these things in an answer. That would be great.
Yeah, I already did that. Like in the previous answer, I told you, like if the program says that we cater for patients from different populations, and you already have an experience of treating patients from diverse cultural backgrounds, and if it's your one of the qualities is that you can easily connect with patients from diverse cultural backgrounds, of course, from your experiences, that's something you can add to it.
Another
Yeah,
good example
and if
is,
if the program mentions that they have this great teamwork and leadership kind of thing that they're looking for in their residents, or if they somehow say in their website that their residents are team workers and then leaders, and if you have an experience in that regard, like if some of your experience made you to be a leader at some point, or made you to do a teamwork sort of thing, you can also incorporate that into your answer.
Yeah,
So
got
I'm
it. Thanks,
kind of
Jeff.
I'm kind of saying that use your experiences and then connect them with your program's missions and goals.
You can just
Yeah,
go
that's a good way to
for
I just
it.
have
Yeah, just go ahead.
Um, yeah, I just
Yeah.
have something to add about what he said. I completely agree with you. And I think another way you could use that is the setting of the hospital or wherever you're applying. So, for example, you have it's a rural area, and you have experience. You did an observership in a rural area in US, so you can tie it to that you have experience, because obviously the patient burden and everything is different, right? Compared to if you did an observership in urban or suburban area. So yeah, that's another way you could mention something that the program would look for that you have experience in.
Yeah,
Yeah, I think
even if a
if
program is, I'm sorry, yeah, you can go ahead.
so, this answer has to be tailored according to the program we are interviewing at. We cannot we can make a sort of framework for the basic thing, but then we have to tailor it according to the program we are interviewing at. I think so.
Yeah, of
Yeah, I
course.
think
So whenever you get an interview, so you want to give some time to review that what the programs and missions and goals are. You go to their website, you study that program really well. Of course, you cannot downplay any of your interviews, even if you're getting like 20 or 22. So yeah, that is something that I think needs to be done, because program directors are like interviewing a lot of applicants, and they know if somebody has studied their program, and if somebody knows their program inside out or not, and they can easily differentiate an applicant who is prepared as compared to somebody who's not.
Yeah, but I appreciate this, like the way you are putting this answer. Good, thank you.
And
Yeah.
even
I
like
have
one
a
more
question
point.
from you.
Yeah, I just will have
Um,
a point to it. Like that depends. Suppose you have your residence or you have your family in that particular area. You can even bring that up as well, right? And programs will give the preference because you have your families or even the residents in that program. That depends. Like every program doesn't have a resident friend or has a family over there. But yeah, if yeah, that depends. Like the type of program. If you have a resident over there who's a senior and you know them, they are from the same city, you can just take a permission from them, and you can just mention that in the interview as well, right? Plus apart from that, you can just go to the curriculum that's specific. Like suppose somebody wants to somebody likes to work on the women health more, right? So certain programs, they have the training more in the women health. You can just talk about that as well, that I like this aspect or the particular elective that program provides. Suppose in critical care, you can talk that I like it more, right? So you can even talk about that during this answer. Like that has to be tailored to everyone. Like you just have, yeah, definitely you just have to research the program, but you can just, yeah, you can definitely mention about the aims and the goals of the program. Then you can just add, like if you have a family over there, you can talk about that as well. Or you can just go through, if you like, the curriculum of that program, if you like the various wellness programs they have for their residents, you can even talk about that during your answer.
I have a question. When you're collecting data about one program, are you just looking for their website? Because sometimes you cannot find it, or you're trying to find it somewhere else as well.
Their
So I
Instagram
mostly,
pages.
yeah, Instagram pages and the website. And it's not important that you can get data for every single program. It's just for those programs that put it out there, and then that's something that you can use to your advantage, I think.
Plus that program is in that particular area, you can research about that area, you can just look around, about the different aspects of that area. Then because you can bring that out, you bring that up during the interviews, right? Because you just have to carry a conversation, right? You don't
Yeah,
need to
even there are a lot of things that if you are applying for a university-based program and you have a research experience, that you can put that into your answer as well. If
yeah,
you're applying to a community program that does not offer fellowship and your primary goal is to be an internist in the future, and that is something that you can add, like, yeah, I want to serve my community, I want to be in this particular area, I want to be an internist later on. And if that program offers fellowship, you can bring that into their answer as well. So yeah, of course, it all comes down to tailoring your answer to a particular program.
definitely.
Thank you.
Hi, I have a follow-up question on the first question. So, just like all the participants have already told here, it's like wonderful answers we got. So many, and particularly Dr. Ritesh Pawani, the answer is basically it is kind of like letter of interest kind of answer we are providing. So my question is, how does this answer differ from the answer that of why did you choose us? If the program asks us, why did you choose our program? So how does the question, I mean, how does the answer differ from each other? Thank you.
Hi, good afternoon, Jerry. How are you?
Hi, can you please repeat your question again?
Okay, sure. Thank you. So the answer we are looking for is I mean, the program asks us, why should we choose you over other participants? I mean, other candidates. Okay, so how is this answer different from why did you choose us? If the program asks us, why did you choose this particular program? So how does that answer, both answer differ from each other? Basically, we mention our qualities and then how we can get along with the program. So how we can make a difference in these two particular answers?
As you can see, doctor, most of the questions, for most of the questions, the answers are like mingling up. For like
Yeah, of course. You know, there is a
difference
lot of
and discussion, answers can be the
yeah,
same, and what you have posed the question and this can be the same. We can't do
yeah.
anything for that.
Exactly. Like you are gonna, make your answers that are overlapping. Of course, there are certain attributes that, you'll be discussing a lot in, different questions. But of course, that's where, the preparation comes in, and you already need to be prepared for these questions, and you already have a certain amount of knowledge for the programs. So you can move a little words here and there. I don't think so it makes any difference if the program is like asking the same question, so why can't our answer be same? It's pretty much the same question if you see it.
Yeah, got it.
Yeah.
Yeah,
Also, I
it
think
makes
like
sense.
if I'm sorry, if the program is asking why did you select us, I think it would make more sense to talk about the program, right? Rather than like this thing that the program has XYZ that like you really like. Like if I hope I'm understanding your question correctly, that was what you're asking, like the response to why did you choose us. So like maybe you go on the social media and like they compete in like conferences and they do poster presentations. You can say like, oh, I like that, that like I have the program offers these opportunities. Or like if they have some community outreach program, like a lot of I think like hospitals would do. So like you can say like, oh, I like that the program has strong ties to the local community. Like just talk about the program and what they do rather than about yourself.
Yeah, I agree with
That
you. And
is,
I just want to
yes.
add something to your answer. Like, even if a program asks you why us, you can, make it personal about a person like who is interviewing you. If it's some chief president, if it's a, program director, and then if you search them up and if they are working on some project or, anything like that, you can also add that into that your answer. Like, if a person is researching on certain topic and you're interested in that, and you can say like, yeah, if I become a part of this program, I can work alongside you on this certain project and that. So that is something that we can bring into our answer as well.
Yeah. And even you can tell that I did my rotations in that particular area and I liked it very much. Or even if you have your family over there, that's why I'm more interested in getting matched at your program. You can just definitely that, you have to get your answer tailored, but the points are going to be the same. Unless and until you can make a very good answer to like why I'm a fit amongst 200 participants, the questions, both of them are, to be very honest, same. The answers are going to be same, and they're unlikely they're going to ask you both the questions during the same interview. But I think the answer is going to be the same to both of them.
Yeah, got it. Thank you. Thank you so much.
The biggest difference, in my opinion, is when they ask you, why did you choose us? Praise the program. When they ask you, why should we choose you? Praise yourself in accordance with the program aims. That's it.
Yeah, exactly.
Right.
Like to be like if somebody asks me like why I want to go to St. Peter's University, like my thing will like I'll mention that I did observership at your hospital. I completely understand your curriculum and I really like your teaching structure and how supportive is your how supportive is your staff and everybody else. Secondly, I can talk that I have my relatives, who just live 50 minutes away from St. Peter's. So that will be a great emotional support for me during your program. Thirdly, then I can just talk about the aims and goals, and I can just talk about these 2 points. Even like I just have to talk about at the end I just need to answer for 60 minutes. So I can just talk about these things.
I think one thing you can add to the question that why should we choose you is like I think you can mention one of your hobbies. Suppose, for example, I play chess, right? So I can say it has developed strategic and analytical skills in me. For someone who plays a team sport, you can add and learn to work in team.
Could you please send me this Zoom link over the email? I think there is some internet connection issue at my end.
What are you saying? Like, can you just repeat it again? By this program, you can answer these points in program collector. Yeah. That's what Gregory Taffo, Dr. Gregory, he's talking about is that program characteristics. Yeah, just it's like if I like to be more into primary practice, if that program is involved into primary practice, I can definitely talk that I like your program more because it has more emphasis on the primary care outpatient. You just have to alter your answers at the end of the day. It's not necessary that I want to go into primary care at the end of the day, right? I might have some plans of fellowships, but I have to see the situation, the program, and then I have to alter my answer accordingly. Yeah, please, somebody was going ahead. Please go ahead.
Yeah, I was just saying that you can add your hobbies and you can add how they've developed certain skills in you and how that's a strength. Like for someone who's in a team sport, they can add I'm well equipped to work in teams and whatever your hobbies might be. I think you can integrate that into your answer so that it's unique and it's not the same as all the other applicants.
Yeah.
Anybody else want to add anything to this question, or should we proceed to next question?
What is going to be the next question? I didn't think about it yet.
Next question. I think we are going to discuss about the animal, right? Isn't it? No, you don't want to mention it?
No, I can answer that question. I'm prepared with that.
Hi.
You can just give me suggestions. That's my
I
favorite
just have a
question.
small doubt.
Yeah, please go ahead. Sorry.
I mean, why did you choose our program? Can we actually also say that being a visa requiring IMG, I also searched for the programs which would take the IMGs as well at last, not in the beginning, but at the last.
I don't think so. It would be a good point because it's not the only one program which is like requiring visa or giving out visas. It's not a unique point of that program.
Okay.
Last
Thank
point
you.
to add, like that's what I heard in one of the webinars. They told that if you want to mention about the resident or anybody else that you know, like who recommended, like you want to talk about some like particular attending or resident in that program, just seek a permission from them first and then mention, because later on they might discuss you with that person, so it doesn't it might they might so you there can be problem later on. So just before mentioning somebody's name during the program which you mention is going to be a plus point, but just discuss with that person before mentioning their name. That's what I heard in one of the webinars, so I just thought that I should be mentioning that here as well.
Yeah.
Hey, sorry to interrupt. I just have one more question. Like, for example, if somebody has a profile who has profound research experience and the same person is getting an interview from a community-based program, so should the person really talk about the research experience that he has in his profile, provided that the program is into primary care? So how should that person tailor his answer?
Sorry, can you repeat it, please?
Yeah, please repeat your question and please be a little bit more loud.
Unless and until the program does the research or doesn't invest in their research, please don't mention about research for community programs, because community programs don't invest their money in research programs. So even if you have research, please don't mention it when you are getting interviewed by a community program. And also don't mention about your interest in fellowship. if their program doesn't have the fellowship which you want, like cardiology or any other gastroenterology or anything, please don't mention your interest also.
But if the applicant has like a year of research gap in his application, so how will he justify the research gap?
Can you repeat it once again?
Sorry, am I audible?
Your voice is breaking.
Need to be a little bit more loud. You just need to be a little bit more loud. We can completely understand you, but you need to be more loud.
Oh, I'm sorry. So I'm just saying, like, if a person has a research gap in his application, then how will he justify that community-based program?
Your voice is breaking. Your voice is breaking. I think your voice is breaking. Can you repeat it again?
Can you type that question?
Yeah.
Ayushman, we have one more question, like most memorable patient encounter. And also, you're muted.
Yeah, I remember. Yeah, that's even one more thing. Plus, there's one more question. When your ethics they were compromised during your experience working as a doctor back in home country or anywhere you worked. So that was another question like that I heard. Sort of that's fine. Like, yeah. So the question you asked, somebody wants to answer this question, please go ahead. Please type it in the chat. Sort of.
Ayushman, if you could please repeat that question about the ethics, that'd be great. What was the question?
I'll just go ahead with that question again. But yeah, somebody wants to answer sort of. Like, we'll just finish with that and then I'll move to the next question. I'll type it in the group, don't worry. Yeah, somebody just raised their hand. Please
Hi, I can actually answer the question regarding the research. I've heard from some of my friends who matched into community programs that their research was valued and they matched into those programs and they were also asked questions about the research of the institution. I think it's better to talk about research in those programs where you know that they have taken candidates who have already pursued research. In only those programs talk about what you have done in research. You can also say that you had the opportunity to delve deeper into those topics of whichever topics you have done the research on, and say that it helps you in better patient care because you already have the experience in that particular topics. And last but not the least, I also had a friend who was told that he was not ranked in the program just because he mentioned that he has an interest in particular subspecialty and that the program does not foster the opportunities or the interest for fellowship. So that's the reason they did not rank him in his feedback when he did not match. So I'm just talking about both the sides of the coin. I hope that helps.
So is your answer like you are somebody just answered it? The last thing that I want to add, like we just discussed in past, few meetings, the same question about the research. The thing is that it's not that you don't have to mention about the research in the community program. It's if they ask you, then you should be prepared with your answers well. But yeah, it's not a very good idea to talk a lot about research during the community programs from yourself, right? If they ask you, then definitely you have to answer those questions at the end of the day. And yeah, the subspecialty question is very valid. That's what even I heard during the this webinars, that let's not talk about the subspecialty because like gastro, cardio, hemato, they're very competitive specialties. So like even if you have to talk about the specialty, you can talk about nephro, endo, other specialties because they're not very competitive. That's what I heard during the webinars, and that's what we discussed in the previous meetings as well. Yeah, that's a very important point to keep. So somebody else wants to answer this question, or like should we go ahead with some other question?
You're telling something about ethics question. Can you repeat that?
That I just saw, there was an interview that Manik Madan did with some Pakistani international medical graduate. So he just, asked a question that, why, tell me about an instance where your ethics they were compromised.
Okay.
So yeah, so that IMG answered that. Yeah, I think Manik Madan only answered about this, that he had there was a lady who had meningitis, and they wanted to admit her to the hospital, but they couldn't go against her wishes at that time because she wanted to leave the hospital at that time. So they discharged her they discharged her against their ethics, and with all the oral medication and everything, but they don't know that what happened with her. That's what Manik Khan mentioned. So you can just come up with something like that, because I think everybody has some kind of instance like that. Yeah, or you could just, right now you can answer about some instance you had. We can even get some idea.
Okay. Thank you.
Response, ground floor, MRI. Post rapid response, ground floor, MRI. Post rapid response, ground floor, MRI.
Somewhere the RRT is going on. It's a critical situation. Yeah, so somebody wants to come up with an instance where the ethics were compromised. Do we have Vijay with us in the meeting right now?
Yeah, bro. I'm here.
Why
You
are you
guys
so
are
quiet?
doing well.
Why are you so quiet? You can just give your opinion.
Yeah, definitely. When there is need, I will definitely speak. You guys are doing excellent. So I thought let me just hear you from your expertise.
Vijay, you are expert yourself. We need your expertise. Yeah, so somebody just asked, can we skip that question?
I want to share some story about the time when I was an intern.
No, please go ahead, Harshita. Please go ahead. You're not
So I was thinking it's an ethical thing and have your input on this. When I was an intern, I was with a lady who had her hemorrhagectomy, and this old lady was shaking while the surgeon.
Please, second, I'll switch off the mic of the person, whose mic is on. I'll just switch it off. Yeah, but
So,
please go ahead. Yeah.
So this lady was shaking while the surgeon was doing the hemorrhagectomy, and then because she was shaking, the surgeon was shouting, "Do not shake, do not shake." And I was there. I was not able to tell anything, but I was feeling really bad for that old lady. So this is the thing that I always feel I should have said something, but I didn't. And um, I wonder, should I mention something like that? For an ethical question?
That doesn't involve your ethics where it was not questioned, right?
It's not like I was with a lady. I was thinking that I have to say something for the surgeon not to shout to the patient, and I didn't. Is that something right ethically?
Yeah, but Harshita, how the ethics come into the picture? Somebody is shaking. Definitely, they might do that out of fear. But surgeon is doing the duty at the end of the day. He's undergoing, he's just doing the hemorrhoidectomy. That's actually what he's meant to do. But the lady never said that I don't want to undergo a surgery, and surgeon was doing it, surgeon was just forcing the procedure on her. So I don't feel that there was any breach in the ethics over here. How you just explain your answer, definitely it must be, you can just tell how ethics were breached in this. No answer
I
is
mean,
wrong.
if the surgeon is shouting over a patient who is already feeling so distressed, so you standing there doing nothing, isn't it an ethical problem?
Oh, just saying it that way, yeah, definitely you can say that I would remain more calm in that situation. I would deal that situation like in a better way. But yeah, you can just say that if you want to say that, you can just say that, yeah, instead of shouting at a patient or something, I would remain calm and composed and try to handle the situation in a better way.
Because I was thinking like this patient was already in a severe distress and the
Yeah,
surgeon
definitely.
shouting over him or her making it worse.
Yeah. Yeah, in America or I have seen many people doing that in India. That's a very common thing. But if but in America, you cannot expect these things from a doctor. That's again unethical, kind of against the ethics, like the normal norm. Yeah. So sort of like, yeah, the one you told is a very good example. Yeah, that's what you can mention. Definitely, that's against the ethics. Like you felt that, the like you didn't feel like, discharging the patient over the herbal medicine, but you can't go against the autonomy of the patient. Yeah, that's a very good example. You can definitely talk about that during the interview.
One thing,
Question.
I
I
have an
just have
example.
something to say.
Yeah, sure, go ahead.
One thing, I'm not sure about the question. I don't think you should be mentioning where you breached ethics necessarily, because that looks very bad. Like, ethics is a very important part in residency. And in this case, if you're saying that the surgeon was shouting and you didn't do anything, that you are giving them information that you breached ethics, right? So I think what the question would be that you had a dilemma in ethics, but you overcame it and you were ethical in that. Like, I don't think they're asking you to provide a situation where you necessarily breached it, because, that's no, I don't think they would do that. But correct me if I'm wrong. I don't know. I'm not sure if that is exactly what they're asking.
Yeah, I
This
think that
situation,
makes sense.
like, please go ahead.
No, go ahead.
In this situation, I think the surgeon shouted on the patient, and you, as a resident or attending or intern, whatever, you try to calm the patient down afterwards. That means like you did your job, like to calm and like make the patient more confident about the surgery.
And one more thing, I think, yeah, it's a good thing that you are making good relationship with the patient and sympathy. But on if you see this thing on an other side, like how you are dealing with a doctor, like working in a team member, it will reflect something on a negative side. I don't know I'm right or wrong, but it's my point of view.
Yeah, that was my point, that in this situation, I don't think you should be giving them information that you in the past have breached ethics in any way, because in this situation, like for example, you were working in the US, right? If you have seen the surgeon doing anything that he shouldn't be doing, or if he's being rude, the proper method would probably be to confront the surgeon, but also report to authority or something like that. So, um, I think just to play it safe, I'm not sure if maybe this answer could have gone well with the program director, but maybe not. So you want to be safe in your answers. So I don't think you should be giving information like that. In this scenario, like a more ethical, for example, I would, for this answer, for example, like STDs or something, right? Like um, for example, a patient comes to you with an STD and he says that, oh, don't tell my spouse or something like that. But as a physician, you had to tell the spouse, right? So that is an ethical scenario that you witnessed, but you have to make sure that you, as a resident or as a doctor, did the right thing at the end of the day. You don't want to give the program director information that you didn't do the right thing. So that's just what I think. But yeah, what do you guys say?
I think you're exactly right. I think the answer should be more focused on what you did, like rather than like selling someone else out. Like what you did to remedy the situation or deal with the situation. Then I think it should be more about talking about yourself, and how you dealt with that situation.
like that again, one situation I had, like I think most of the situations are similar. Like, when I was working in the Department of Nephrology in a corporate hospital, at that time some patient came with a volume overload. So he, immediately, like he was a dialysis dependent patient, but he came presented with an emergency with a volume overload. So he immediately needed a dialysis. But yeah, like we talked to the patient, discussed everything, but his family agreed. But the patient wasn't ready to undergo dialysis because he had a dialysis the previous day only. So at that time we couldn't do anything. We can't go against the autonomy of the patient. So we had to we had to let him go like that only. And probably after that he died actually. So that was one of the incidents that I had this year in the starting when I was working in nephrology.
This is the tricky part. That question specifically states that tell us of a situation where your ethics was compromised. So either like we mention a scenario where we did nothing on our part that would look bad on the for the PD, or either we mention a scenario in which we overcame the ethics that wouldn't answer the question. That's the tricky part.
I think just to clarify, I think in this, for example, a situation where you have to make an ethical decision, your ethics is compromised. Usually, either the patient will want something else or you will want something else, but ethically, you do have to do something else. Like you have to perform it. So, like usually in all ethics scenario, it's compromised, right? So I personally don't think they're asking you when you didn't perform ethics, right? Like because in these scenario we're saying when we were ethically wrong. So I don't think that's just what I understood. But yeah, that is true that they did word it. And usually I would guess that in an interview they would be more clear. And in case they're not, you should always ask the interviewer to repeat or clarify the question, because obviously you don't want to give them any information that would ruin your interview, right? So
And to answer this question, we just read during the bioethics, like there were four, like duties of the doctors. Like one was on autonomy, beneficence. I don't remember the exact terms, that you have to treat everybody equally. So we can just use those two terms that over in this situation, the autonomy, overpowered my ability to give the best treatment to my patients. We can just search that particular term, and we can just make answer better, right?
And
Because
what about, yeah, this thing like Dr. Ayush, you just said for the patient and you did dialysis. After that, you said that patient expired. You can like rephrase it like you did your best. The family didn't consent it, or the family consented, but the patient didn't. What I did was I did dialysis and the patient improved on the next day or so on. So here the ethics is getting wrecked. You did your best and patient got improved. So, what are your thoughts according to
I
this
would
one?
say that since patient had, he was in his senses, like he was
Mm-hmm.
able to take the decision very well, though he had shortness of breath and everything. It was an emergency, but patient was in his sense and he could take his decisions independently, right? So that otherwise, if he would have been unconscious at that point of time, definitely we would have done the dialysis for sure. But since he was
Yeah.
over there, he could just take the decisions, like he was in proper sense, and like he had his decision making capacity. That was the right term. So I couldn't overpower. I couldn't just breach his autonomy just to provide him the best treatment. If he refuses, I cannot do anything over that. So I feel that my ethics were compromised at that time, but yeah, I had to do
Mm-hmm.
what was the best for that situation.
Yeah.
Otherwise, if he would have been unconscious, we would have done the dialysis for sure.
Hi, I think for this particular question, as many of you mentioned, that we wouldn't want to put down someone, or I think it would be better to go on a neutral tone, but also give an instance where our ethics was compromised. I think I would probably answer with an example saying that, for example, when I was working back at home in a corporate hospital, I did come across multiple cases. To specify one, for example, a case of severe polytrauma after a road traffic accident, which happened very close to our hospital. The patient was wheeled in, but unfortunately, the family and the patient could not afford the right treatment in our hospital. Uh, so I would say that though as a doctor, I felt it was our ethical responsibility to take care of the patient and get him to the best that we can. Unfortunately, because of the patient's situation and how the healthcare system works, we had to transfer him to a government setting, which was probably not nearby and would not probably have the same facilities that our hospital could probably provide. But in spite, but since we had the limitations of the patient's financial situation and how the healthcare system is, we had to compromise and let the patient discharge to the other facility, though we were aware that probably he would not have the same outcome with respect to the treatment that he could have had at our institution.
I think for this situation in the US, we cannot refuse healthcare in emergency settings.
Even in India, we can't refuse.
Yeah.
But yeah, that's what she's saying. You can just add, like, we gave the best, initial treatment in the emergency, but after,
Yeah, like we only did the preliminary, like probably stabilize the patient, and then we had to shift him over.
Yeah, you can mention that. That makes
Yeah,
better.
recently with the Ayushman Yojana, I think people are getting the proper treatment these days, and we don't have to turn them down at least till 5 lakh rupees.
That's actually a very good answer, but at the same time, it is a complex topic. And my approach to this question would be to pick something simpler that's 100% universal, right? Like the example I gave, for example, an STD, right? Like anybody who has an STD, you have to, and they have sexual relations with anybody, you have to, universally, you have to inform them. Compared to if you're being specific to India's healthcare or US healthcare, you're kind of giving them, you're almost giving them a point that the Indian healthcare and US healthcare, like their ethics are very different. So yeah, that would just be my approach to try to, although like I did think that your answer was actually pretty good. If I personally was a program director, I would like that answer, but at the same time, I'm not sure if that's universally accepted. So
Just to clarify, I thought they were asking for a personal experience from your from what you have had, or are they looking for something more generic? I was of the assumption that they wanted something from our experiences till now.
yeah, it is. Sorry. Yeah, it is through our experience. The example I'm giving you is just a generic one, but I'm just saying that if you have an experience that is that is universally accepted, then I would choose that over something that's not. But of course, if this is the most important experience to you, then you should share it.
Yeah, thank you.
To be very honest, I just like the response very good. Like you're talking about the accident and everything, because everybody will come up with a similar response at the end of the day, right? So because like somebody had meningitis, we had to discharge. Somebody had a pleural effusion, and we had to discharge against their wish. Like even I have the similar example. Somebody needed a dialysis, and we had to discharge him like against our wish to do that dialysis. So that can be a good example. Like even I will have to think about if I had some instances, because most of us have all these instances happening. But yeah, we just need to find that out during our experiences.
I have an example. Can I share?
Sure, please go ahead. We need more examples.
Okay. When I was working back in my country in Nigeria, in the emergency room, I had this couple who came in to the emergency room. The wife was really, really sick. She had fever, and we did all the blood work, and then we found out that she was HIV positive. And then she called me by the side and told me that her husband is not aware about it. And then she was admitted into the emergency department. And then the husband later came to me and asked me what was wrong with his wife. And I just told him the general thing about fever, her having sepsis, but I did not mention that she had HIV positive. So can I use that as an example?
If somebody wants to answer that question.
But I think you should mention about HIV to at least her partner, right? It's going against the ethics. Even if the patient is not willing to expose her disease out, but I think it's your ethical responsibility to mention STD to at least her partner, not to their family.
Like I don't know, I don't do academically I'm not very sound. There are definitely better people than me, but I think like whatever ethics question I've done, like you don't have to talk about, you don't, it's not necessary for you to disclose about the pregnancy and the HIV thing to your partner. Like I don't know, I think I have read it somewhere during the ethics,
Yeah.
but somebody please
Yeah.
just add to that.
Yeah, I think from studying from the USMLE step 2 and step 1, for sexually transmitted disease, you only report to the community, to CDC, not to the partner. It is the patient's responsibility to tell his or partner. You only report communicable diseases to CDC and not to the partner. So if you tell the partner, it's a breach of confidentiality.
Actually, I'm sorry, but like I think I just recently gave step 2, and I mean, I remember reading that if a patient has like one of those 5 communicable diseases, right, you first request the patient that if they are willing to like disclose, but if they show like clear signs of they say that they are not going to, you need to tell it to the partner. Or like another way is like reporting to the CDC, and then they like report it to the patient's partner, like, but it happens like either of ways. And I also
Yeah, I
feel
think
like I'm sorry, like I also feel like the example that you gave, it's like it's clearly showing something that you didn't do. And I think I don't know, like I feel like all these questions are should be answered in a way that it shows like your one quality. And here you're definitely showing something that you didn't do. I feel, again, like you're losing an opportunity to like say something about yourself. Yeah, that's what I feel.
Yeah, so I think Onaiza just raised her hands. Onaiza, you can just go ahead, like you raise your hands.
Oh yeah, I just wanted to say the same thing, that first you have to discuss with the patient and encourage him or her to tell their partner or report it to the CDC. And if they are not doing it and it's a communicable disease, then you have to report it yourself, according to the USMLE information I have.
I think, yeah, actually she was, you do, I think, first report it to CDC, and it's their job to tell the partner if the patient doesn't themselves. So maybe in this case, the story is okay, but maybe you could mention that you did report it to CDC just to make sure that they don't think that you're breaching ethics, and you did do your part and you did report it to where it's supposed to be reported. So maybe that could be a way to use this story, but also not breach ethics.
So you can just, do your study first, like you can just read something about the ethical part regarding this, and then you can frame your answer accordingly, right? We just have to make, like we have little bit make up stories as well, right? Because everybody have the instances in their life, but everybody doesn't remember them, properly, right? So you just have to get the ideas and you have to accordingly frame your stories. So anybody else wants to answer this question, or we are done with that? Or we should, or somebody wants to discuss a previous question, we can do that. We still have 15 minutes because yes, today we discussed the 2 questions and we got very good responses for that. If you want to add something, please go ahead. Like we still have 15 minutes to go. After that, we can end the meeting.
Can you discuss, tell me about yourself again, like how to structure that? You have to repeat your CV or tell about yourself.
Okay. Somebody wants to answer that question, please go ahead. Harshita or somebody, Harshita, yes, go ahead.
Yeah, I had a question, but it's unrelated to the interview. So, like we said, for the community programs, right? You're not supposed, like they're not, if they don't have any fellowship programs associated with them, we don't talk about, doing fellowship in the future. So I like during the residency in the community program, do we have like rotations like specifically for like any of these fellowship specialties? Like,
Yeah.
is it very different from the university hospitals? This one structure?
Yeah, no, no, Harshita, definitely we have the different, like we have the gastro, you have I think those are called as electives, right? You definitely have those rotations and you do it electively, you choose that. And it's not important. It's not like you don't have to mention about the fellowships. If you want to do, you can just mention like that's what people say on, webinars. Like I think it's everybody's first math season or the second math season, right? But that's what they say that you should be mentioning about the competitive one because your program might not be able to support that, right? Like if your program offers gastro cardio, you can definitely say I want to do that, or you can just say like yes, I want to do fellowship in future. But yeah, but I would like to explore more during by doing different rotations during your program. So that will actually shape that will give me an idea that I want to do some fellowship in which branch.
So, specialties like cardiology, for example, they are a must, right? In both, like, be it a community program or a university hospital, right? You'll definitely have a cardiology like block, isn't
They
it? Yeah.
have it.
Thank you.
They have it. Yeah. So somebody wants to answer. Tell me about yourself. We still have 13 minutes. Like I don't want to talk about it because I want other people to speak. I've already answered that question twice. So anybody wants to voluntarily speak and tell me about yourself. It's just like somebody who has not, like even if you have not drafted your question, you can just speak. Nobody wants to answer the
You
question.
can start off, I can give you like few points. So you can start off by saying, my name is this and so and so. I'm from
Sorry,
uh,
just to interrupt you. You just believe some Dr. K is a PD and he's asking you this question. How will answer that question? Just go ahead with that. It's okay. Nobody's going to judge you. Like it's fine. Like we can just give our opinions to that. It's just a practice session for all of us.
Okay, so my name is Harshita and I was born in India, but I grew up in Dubai and I did my medical school from there. I'm living in, sorry, someone was saying something.
Question, just go ahead. I'll switch off their like I'll mute them like this.
Okay, yeah, so currently live in Atlanta with my husband. And this is the only thing that I actually thought about. Like, rest, I don't know if anyone wants to like add more points, please feel free to.
Yeah, let me try.
Sure, go ahead, please.
Yeah, yes, for sure, doctor. Good morning, everyone, and good morning, Dr. XYZ. First of all, thank you so much for giving me this opportunity to express myself within the program. My name is Nirmit Patel. I'm from India, and I completed my medical school from GCS Medical College. After finishing my medical school, I came here to United States for further hands-on clinical experience. Right now, I'm working as a clinical extern at MedStars Primary Group, which is primary care center in Maryland. I am the first one in my family to become a doctor, and my mom takes care of the house, and my dad is working at Asian Paints company. Apart from my study, I am individual who loves swimming and playing table tennis. In my free time, I love to teach dental student about pharmacology and help my family members how to invest in the stock market. I love spending time with my family and friends. Right now, I'm really hopeful about getting into a residency program. In the future, I want to be a great doctor, maybe even a cardiologist. That's pretty much about me. Thank you.
That's a nice introduction. That is a perfect answer. But yeah, that's what they say. Just to mention about the speciality, just keep it to yourself, like depending on the program. Otherwise, it's a very good answer. That's what you have to mention your hobbies, like little bit out idea about your background, your family, your hobbies. Yeah, that was a very good answer.
Yeah, any comments is fine. Like,
Dr. Gupta, I asked someone and they just advised me like do not always start with your name because they already know your name and say hi, hello, good morning, whatever your name is. Then try to start from where did you graduated actually rather than starting from your name. So your thoughts on that one?
Anybody wants to answer?
I mean,
that? Yeah, please.
I think like what I think like that's an like first questions to everyone as an like interview session. So it's not bad to introduce yourself first and then an educational background.
Yeah.
Yeah. Because tell me about yourself, you're going to give an idea. Like that's what we discussed like in the previous meetings, as everybody said. You just have to give an idea about yourself, your little bit of background, your personality, your strong points, because that's how they're going to direct the interview from there. Like you mentioned about cooking, they start might asking you about the cooking. Right? Somebody likes reading books, they might ask about the books. Somebody wants does something else, they make YouTube videos, they might ask about these things, right? So that yeah, so you just have to mention. And I think yeah, you should mention your name, sure. Like it doesn't matter. Like if you don't mention, if you mention your name, they are not going to take away the chance of giving you the spot in the residency for sure. Like I think it's a good thing to mention your name, like that it looks nice. At least they'll be they might know your name. It will be easier for them to communicate with you.
Yeah, thank you.
I have a question.
Sure, go ahead.
Yeah, so if like in a interview, if I don't know the person, obviously we'll like we'll do our research regarding the program and the program director and everyone. But like if the person doesn't like introduce by their name or just ask like tell me about yourself, should we ask them like may I know whom I am speaking today? Like is it like okay to ask their name?
So like whosoever asked this question, so anybody wants to answer to this?
Hello, everyone.
Yeah, please go ahead.
I just feel like you shouldn't ask directly who I'm talking to. That will have a bad impression. Like you don't know who are you interviewing with. But you can definitely ask like, how do I address you? Like Dr. So and Dr. So, like that way.
Okay. Thank you. I was also thinking that way, but yeah, now I just want to make sure. Thank you so much.
And when you get the Zoom link, definitely I think they'll mention about the doctor's name over there. Otherwise, yeah, you can just ask them how should I address you.
Okay.
And also, I think you guys like are given a schedule prior to the day of the interview, telling you who you're gonna be interviewing with. So you will be able to research them and find out what their names are and stuff.
Okay.
So just 6 minutes are left. We'll just go ahead. We'll finish with everything. But just I have to mention that tomorrow, the two questions like somebody told in the chat box, we can talk about our leadership roles, and we can just talk about our good experiences during the medical school. Is that okay? I just write group as well, like leadership and whatever. Research questions somebody wrote. Nimrit wrote about the research questions. Definitely, I think tomorrow we'll just talk about these and some past questions, like those who joined late, they can just discuss like whatever they want to discuss. Then on tomorrow it's 6th. On 7th we can no, today is 6th, right? Tomorrow is 7th. On yeah, so like one day we'll discuss about the research question. Everybody can give their ideas how to talk about the research thing and their whatever research experiences they have, so we get a better insight, right? So yeah, and then we can just we can just add this professional failure also, that we are free for the whole month. Like we can just keep on talking about these things.
And then one day, can we go with the questions which we want to ask the program?
Yeah, sure. We see we're not paying anything for these things, right? Even if you don't want to join this meeting, you can organize your own meeting. You can send your links, whatever you want to do.
Okay.
Right. So we can definitely you even type in the group that can we discuss these questions. Where I'm no one like I'm not saying that you can. I'm not one who is going to force you to discuss these questions only. Right. I am here to just keep my prep regular. Right. Otherwise, I wouldn't be doing anything about the interview preparation. At least I come here, I talk to you guys. I've made I interact.
I think Ayushman, I think we should take more questions. We should be more organized. This way, it is not working. I think like we should take like 5 questions questions, ask people to prepare like how we started, right? So we should prepare for those 5 questions, let people speak, quickly take turns and move on. Like this is like more not that organized. Like right, it is more like a discussion rather than practice. So like the more like the girl who started, right, giving about herself why she should be selected. If we do like that, if you guys come prepared, like there will be like few people who will give critical feedback on how you are speaking, what mistakes you're doing, right? I think that would be more effective. You would also be, like actively preparing your answers and even speaking as well. So right now you're just listening passively. So even you are not getting much out of it. So like you will be bound to make your answers, right? Once you start speaking. So I think that is a better way to do it.
Yeah, we can just do that. I'll just write the answers like the leadership role, good experience during medical school. You can just prepare that and you can answer, you can practice, right? You can just turn on your mics, not even your camera. You can just turn on your mics and answer those questions, right? So we still have 3 minutes to go. Anybody wants to talk about anything else?
Dr. Gupta, can you just guide me if someone is asking, tell me something related to your research, how our answer should be?
We can just keep a specific day. For like I can just I don't. So what I will say is the different experiences that I have mentioned on my CV. The thing is, you should know that well, right? Like the topics, what type of studies that, like how you got those opportunities, right? And then what were the outcomes? Like you did an observational study, you should know the outcome also, right? That's what I was just sharing on the video. Like it was by USMLE Sarthi. He was talking about the research thing. Then he told that you should even know about that. It was Pawan over there on YouTube. He told that you need to know about the outcome as well. Like you have some observational study or some cohort study or something. You just need to know the outcome as well, not just like I just contributed in writing the introduction part and that's it. Like he told that you need to have, you need to know about the outcomes and even, tell that, the study had this outcome, then where you presented that study to which conference and it was published in which, article. So you have to, like, that's what I read over there, but I have to, even read about whatever I have mentioned in my CV. I'm not confident
Yeah.
about that.
Okay, thank you.
A better way would be like, you frame your answer something about research and like people here will give you critical feedback, like what Nirmit has a good experience. Nirmit can talk about like what you should speak or
Yeah, that's
not,
another
but
thing. Like I have on a multiple research on my platform, so even I am not sure like what they are going to ask in the interviews. But as of now, like I like in the last year, I gave the interview to couple of research position also. So in that field, like they usually ask like what is your role, and the second thing is like what you know about the research, and third thing is the main part which is conclusion, what you learn and what your research is suggesting of. So that's a total 4 questions they usually ask during the time of interview, and nobody cares which author you are on and what you like know exactly about the data analysis. These that they only want a clear answers like what you know and what's the conclusion of the study. That's the two main focus.
Yeah. So quick question by somebody in the chat that if you have to reschedule an interview, can you do it once? Like, has anybody any
So
idea?
as for the rescheduling, you can request to the program coordinator in initial time, like they have like pretty much slots. Like for the first slot they usually send an interviews and trying to schedule an interview on a specific dates. But if you want to reschedule an interview, that's an like hit or miss. Sometime the second slot is not open right now, so might be they cancel your interview and we are not sure in the future they are scheduling interview in a second slot for us or not. So I think if you get an interview right now and if you are scheduling the interview in a, like after 2 or 3 weeks, that's I mean good, because like some of the programs wants the candidate to present themselves as an a like in-person interview rather than the virtual interviews. So we don't know, like even in the later part, if we have an in-person interview, we have a sufficient time to travel.
So Nimrit, somebody requested you to repeat your 4 questions. Can you go ahead? Saurav requested that you can repeat your 4 questions.
The 4 questions, the first one is what do you know by your study? So like for example, if you have an like title, for example we can like take a simple study, like role of the biomarkers in a myocardial infarction. So the first question they will ask is what do you learn by this study? The second thing is what's your role in the study? The third one is what's your conclusion of the study? And in the last question, I'm not sure, like the last question is for everyone, like how do you know about this research work?
And Pawan also mentioned that in his video that I watched on YouTube, that how your research is going to add to already existing data. So we have to research about that as well.
Yeah, but like in a most of the in the research work, the statistical analysis is usually done by an MPH student or might be a professor who is like biostatistician or anything like that. So and also the analysis part is much more tough for undergrad student. Like we are like just completed the MBBS and the USMLE. If you have a like MPH degree, then you are expecting these questions. But as an like freshers, like stata analysis, R method, Rayman, they are like way more difficult. We have to learn their softwares and everything. So I don't expect that question during the time of interview.
Yeah. You can just talk about like your experience, what you did during the research thing. Like if somebody asks you this question, right? Like what did
As
you?
of now, like I'm not prepared for that one, but let me give it a try. So if someone is asking me about my research work, like for the first questions, I will honestly say that like I know I was involved in couple of research work. Right now I'm doing the work with University of Pennsylvania regarding the cardiology subject. My upcoming research in AHA, blah blah blah, which is like my next presentation in the AHA. I know like in the research my main part is as an analyst. I used to focus on a analytical part. Also I am reviewing the whole manuscript and also doing my data extract and on a side time. So for me the research is the main part of the medicine, and with the hope of the research I can give more to the patients and in the medical field. That's my introduction part.
Yeah, that's a very good answer. Yeah. So like, should we end the meeting because this meeting is going to happen like